our first panel consists of 4 people whose work I've admired for quite some time, and I'm really excited to be part of this dialogue with them. In the order in which they will present, I will tell you now. Kerwin Kaye, who's to my immediate right, is an assistant professor of sociology at SUNY College at Old Westbury. His most recent publication, Rehabilitating the Drugs Lifestyle, and drugs lifestyle is in quotes, by the way, Criminal Justice, Social Control, and the Cultivation of Agency, appeared quite recently in the journal Ethnography. His current, that would be this year in fact, his current book project, which we've all been anticipating greatly, is titled Using Drugs, Addiction and the Intimacy of the State, and is based on ethnographic research conducted at both a drug court and an affiliated drug treatment center, and he currently lives in New York City. After him will be Dr. Mindy Thompson, Fullilove, MD. She's a research psychiatrist at New York State Psychiatric Institute and a professor of clinical psychiatry and public health at Columbia University. She was educated at Bryn Mawr College and Columbia University, where at Columbia she took an MS degree and her medical degree. Fullilove is a board-certified psychiatrist, having received her training at New York Hospital, Westchester Division, and Montefiore Hospital. Since the 1980s, she has been a pioneer in public health examinations of the links between environment and mental health. She started her research career in 1986 with a focus on the AIDS epidemic and became aware of the close link between AIDS and other epidemics in poor communities, with a special interest in the relationship between the collapse of these communities and the decline in health. Under the rubric of the psychology of place, Dr. Fullilove began to examine the mental health effects of such environmental processes as violence, rebuilding, segregation, urban renewal, and mismanaged toxins. From her research, she has published Root Shock, How Tearing Up City Neighborhoods Hurts America and What We Can Do About It. And I should say I've taught that book many times, and each time I seem to find something new in it. Also, she's published The House of Joshua, Meditations on Family and Place, and her most recent work, which just came out a few months ago, is called Urban Alchemy, Restoring Joy in America's Sorted Out Cities. Next will be Robert Cordero, who serves as President and Chief Program Officer of Boom Health, a newly merged and rebranded Bronx-based $11.8 million nonprofit agency organization. Boom Health is the recent result of the August 2013 merger of 2 well-known New York City community health organizations. Those would be the Bronx AIDS Services and Citywide Harm Reduction, the latter of which had Cordero as its executive director. The new Boom Health has a combined staff of 133 individuals and delivers a full range of services, a full range of prevention, syringe access, harm reduction, healthcare coordination, behavioral health, housing placement, legal, advocacy, and wellness services to over 8,000 clients in the hardest to reach communities in the Bronx. Boom Health strengthens efforts to remove barriers to accessing medical care, with particular emphasis on HIV and viral hepatitis prevention and care services. The vision of the organization is health, wellness, and safety for all, and Boom Health is driven by its mission to transform lives through health and wellness. And finally, Glenn Martin is currently the Vice President of Development and Public Affairs and Director of the David Rothenberg Center for Public Policy at the Fortune Society, Incorporated, a nonprofit organization devoted to the successful reentry and reintegration of individuals with criminal justice involvement. In these roles, Mr. Martin is responsible for developing and advancing Fortune's policy advocacy agenda and providing leadership over the agency's development and communication units. Mr. Martin works to create partnerships with other advocates and policymakers to advance criminal justice policy reforms that serve to remove counterproductive, practical, and statutory roadblocks facing people who are working to reintegrate into our society. Without further ado, please welcome all 4 of these esteemed panelists for me, and we will hear from Dr. Kaye.
Morning. I'm very excited to be here today. I wanted to talk a little bit about the limited success that I think we've had as a movement in overturning the Rockefeller drug laws. And I also wanted to talk about the danger that the current set of drug laws that has replaced those Rockefeller laws, and particularly to talk about the hybrid form of drug courts that has emerged that combines both law enforcement and public health approaches to drug abuse. So as you probably know, in 2009, the New York State passed the Drug Law Reform Act, reportedly, according to many groups, New York Civil Liberties Union, ending the anti-drug laws that had been put in place by Governor Rockefeller in 1973. The Drug Law Reform Act replaced automatic prison sentences with a system of judicial diversion, more commonly known as drug courts, thereby allowing first-time nonviolent drug offenders the opportunity to receive drug treatment in lieu of incarceration. But while this perhaps sounds good, and I would argue indeed there are some benefits associated with this approach, there's a number of shortcomings that not only render this policy, to me it seems, deeply problematic, but that also reveal disturbing continuities with the prior Rockefeller-era laws. So with my time here today, I want to talk about the nature of some of these limitations, particularly in relationship to the types of rehabilitation centers that the drug courts are relying upon in order to provide treatment. In my own research, I conducted an ethnographic study of a drug court located in a major metropolitan area on the East Coast, interviewing some 100 people, judges, staff members, participants, and spending some 10 months in particular observing how one of the treatment centers worked while making briefer visits to another 4 rehabilitation centers. So while a number of other organizations and researchers have criticized the drug courts, and I'll begin by briefly touching upon a few of the key points that emerge from their comments, I want to provide you with a clearer picture concerning the treatment side of this equation, hopefully revealing just how far we will still need to go in challenging and changing this system. So in the first place, it should be noted that an increasing number of organizations have taken stands against the system of judicial diversion and the drug treatment court system. The National Association of Criminal Defense Lawyers issued a critical report on drug courts and other types of problem-solving courts in 2009, while both the Drug Policy Alliance and the Justice Policy Institute came out with sharply critical reports in March 2011. The Sentencing Project has also issued reports that have been critical of drug courts, but also some in favor. These reports cite far too many criticisms for me to go into at present, but I wanted to highlight a couple of relevant statistics, some from these reports and some from data collected by the New York court system in order to suggest a couple of issues that are at stake. And one of the issues that is used to support drug courts, the Center for Court Innovation has found them to be effective in their mind, finding a 32% reduction in recidivism, which is then used to calculate cost-benefit analysis and shows a benefit in going to the courts. However, it should be noted about 50% of participants, or anywhere from 33 to 75%, depending on the court, do not graduate and are in fact sentenced for drug crimes when they fail out of drug treatment. And also importantly, blacks drop out of treatment 30% more frequently than whites. And those who fail at treatment generally get sentenced to prison terms that are longer than if they had initially just accepted a plea bargain arrangement. In some instances, anywhere from 2 to 5 times as long, because they accept a guilty plea often for a non-plea bargained charge. So in other words, what the court does is not end the use of prison around drugs, but it in fact differentiates the effects of the drug war, mitigating penalties for some who are more privileged, whether by race or class, and actually intensifying those penalties for many black and poor participants. The drug court that I examined had separate tracks for misdemeanor and felony cases, and I want you to notice the drug of choice, the first item there that was listed under these 2 tracks. So under misdemeanor, 13% had marijuana as drug of choice, and under felony, 61%. This is explained by the fact that the majority of the felony cases were dealing with drug dealers rather than intensive drug users. Dealers in the program were systematically younger, less white, more male, and often had drug use patterns that were less intensive than those charged with simple misdemeanors. Nevertheless, the majority of the court's cases dealt with felony cases rather than misdemeanors because people with misdemeanors often preferred to receive a simple sentence rather than to subject themselves to the uncertain outcome that would follow the intense 18 to 24-month time commitment involved in completing the drug court program. But despite having this less intense pattern of drug use, those charged with felonies are assigned to inpatient facilities, which are supposed to be more intensive treatment, just as regularly as those who commit misdemeanors. And yet those with misdemeanors have more intensive patterns of drug use. In speaking with people at the drug court itself, I saw that the DA's office had a disproportionate say in controlling these assignments, based on the fact that they could withdraw their support for a given individual's participation if they were unsatisfied. Individuals in the DA's office openly acknowledged that they often base their recommendation in part based on public safety concerns, and that the inpatient facilities were becoming, in their own words, mini jails. In asking one DA who worked with the court who they would see as a good candidate for inpatient treatment, I was quickly told someone with a job. So thus, not only do the treatment centers come to take on a custodial function as they accept more and more people from the criminal justice system, but the pattern of referrals explicitly reinforces class privilege within this structure. Beyond all this, there's also the mechanism through which drug treatment achieves all of its 32% success, which, to put it very simply, basically involves a lot of yelling. A lot of tactics that are explicitly designed to produce shame, and a lot of intense coercion, even to the point of marginal legality. So the treatment center where I spent most of my ethnographic time had a reputation for being rather mild in comparison to some of the others. And indeed, compared to some of the stories I heard from participants about some of the other facilities, it was in fact rather mild. And yet, nevertheless, just in my own observations as an ethnographer, I was often made rather uncomfortable by the way that the staff treated the clients, and this despite the fact that I truly liked the staff and believed that they had good intentions. So the worst incident that I witnessed at this comparatively mild facility happened at a time when the staff had decided that there were too many rules being broken and that something had to be done in order to sort of reinstill order into the house. The way order was usually maintained on a day-to-day basis was by forcing the residents to enforce the rules against one another. You can imagine how that would go over in sort of an anti-snitch culture. If a resident knew of a rule being broken and failed to report it to the staff, they could themselves be penalized. In this incident, the staff decided that this tactic was no longer working. This is something that happens every maybe 10 to 12 months at the facility. And so they needed to impose collective punishments against everyone in the house. And I just want to read a bit of an ethnographic vignette concerning the way this was done. What are you prepared to do? The assistant director kept playfully but earnestly challenging the rest of the staff with this Sean Connery line from The Untouchables. The staff as a whole had decided that the house had gotten out of control and that order needed to be imposed. One of the residents had broken a cane and then thrown it at another resident, fortunately missing them. Sexually explicit love letters had been found written between another two residents, both of whom were married to other people. Another of the residents had been loaning out small amounts of money to others. And worse yet, when one of the residents was challenged about being one of the borrowers, he responded by asking, "What business is it of yours if I borrow $5? Two residents had gotten into a yelling match with one another, and there were even reports of gambling downstairs. A general meeting had been called, and all of the residents were sitting downstairs in silence, monitored by a staff member, while the rest of the staff sat upstairs and decided upon exactly what penalties to dole out to each resident and how to reimpose order more generally. What are you prepared to do? Asked the assistant director again. The fundamental problem, staff decided, was that residents were refusing to enforce discipline with one another. How can they report on anything when they all have secrets to hide? The staff decided they need to reinstate the, quote, Peter pays for Paul principle in order to make people, quote, look at each other's stuff. Peter pays for Paul basically meant that collective punishments would be imposed for all wrongdoing. Through the enforcement of these collective punishments, residents would be pressured into policing one another's behavior. According to the staff members, the idea was to force the residents to interact in a new way, to push them from a, quote, subversive way of relating, and to push them toward the establishment of relations based on law-abiding and rule-abiding behaviors. I know they're adults, but sometimes we have to play the part of parents, offered one staff member. We want to get tough, not just on the people doing things, but on everyone who's colluding with them. By the time the staff finished in their task and arrived downstairs, they had changed their emotional tone. They entered the room almost growling. The assistant director again took the lead. "Sit up straight, hands on your knees. You deaf? Hands on your knees. A general meeting is the most important meeting we have. There's some sorry-ass shit been going on here. People gotta step up. Nobody's stepping up. Nobody's taking any responsibility. This is your house and you gotta run it, but you aren't running it, so this is what happens." This berating continued for about another 20 minutes before the staff proceeded to call up each of the offending residents one by one to address their infractions. The new resident who had been bragging about being a big-time dealer and loaning small amounts of money to others, for example, had it pointed out to others how he had been wearing the same clothes since his arrival a week prior. "How do you wash those clothes anyway, if that's all that you have? If you've got his money, please pay him back so he can go buy some clothes." These comments elicited widespread laughter amongst the assembled residents. Likewise, the woman having a sexual affair with another resident was called a homewrecker and had her sexually explicit love letters read aloud to the greatly amused audience. "You're making me look like a fool," she protested meekly. "We're not making you look like a fool. You're making yourself look like a fool." A third resident, a woman who stood to lose custody of her child if she failed at treatment, was chastised for getting into shouting matches with another resident, a fact that it put her ongoing status in the program at risk. "Why don't you just give your daughter away if that's how it is?" asked the director of the facility. "You could be going home to see your kid if you wanted to," added the assistant director, "but I guess you don't care." "I can go home and take care of my kid and kiss my kid," chimed in one of the other staff members loudly and angrily, "and go to sleep and get up the next day and it's all good because I've done the work." Speaking to the entire group, she added, "None of you have done the work, and just a few of you are going to make it. You know, you all put yourselves here. And if you don't want to be here, you can just walk out the door. Please do." The woman being confronted began to cry, and the staff member's voice quieted a bit as she turned back to her. "Welcome to the pain, and that pain is just going to keep coming until you decide to get better." After these individual shamings, the assistant director challenged the entire group. "This is about making you face up to your responsibilities. If you're not here to do the work, leave. You'll make it easier for all of us." Collectively, all of the residents were placed on house restriction, no days out for any entertainment or church purposes, and no family visits, even for one resident being treated for cancer. Now, after midnight, residents were allowed to return to their rooms, only to find that staff had one additional penalty for them. Prior to the meeting, while the residents were sitting in silence downstairs, staff had gone through and thoroughly ransacked all of the residents' rooms, systematically throwing every personal item onto the floor. Mattresses were overturned, clothes thrown carelessly into the middle of the room, lamps pushed over, drawers removed from shelves with their contents dumped, a true cyclone of a disaster enacted by these counselors and the floor staff. Now, after midnight, residents had to thoroughly clean their rooms prior to going to sleep. So ordinarily, these rooms they're required to keep them in just immaculate condition, hospital corners on the beds and so on, and you can see what was done afterwards. When I returned the next day, and despite the risk of arrest that would now follow them, 3 residents had fled the program, including the woman called a homewrecker. But while virtually all of the residents I spoke with complained about the meeting, and many complained about being punished for things that they did not do, many residents also spoke to one another about having to shape up in order to avoid such treatment in the future. Hence, as I understand it, the therapeutic benefit. Even with all this happening, residents continue to feel that this facility was mild in comparison to some others. I heard stories, for example, in which residents were required to wear large dunce caps, stigmatizing signs such as "I'm a crybaby" or "I'm a thief, please confront me," or to wear adult-sized diapers worn over their clothing as punishments. All this was done with the therapeutic justification that the residents lacked consequentialist thinking, and that punishments such as these were therefore essential to their recovery. In speaking with the Office of Alcoholism and Substance Abuse Services, or OASAS, the state agency that regulates these private facilities, I was informed that practices of this sort were frowned upon and considered abusive, but that they were not considered illegal. Such practices thus constitute something of a regulatory gray zone, shading, however, toward the lighter side of gray, with very little chance of actual penalty except in extremely severe cases. One of the district attorneys I worked with in the drug court, upon hearing these stories themselves from the people that they prosecuted, had concerns about the constitutionality of such punishments and actually called IRAAS to see their position. But upon hearing that IRAAS already knew about these practices, the DA abandoned the issue. Now, I should say that despite all of these abrasive and abusive practices, many residents, perhaps half, found their time within treatment to be helpful, although not pleasant. A significant minority, perhaps 10%, credited the program with saving their lives and would say such things as, "Thank God I was arrested," a phrase I heard more than once. Some of this occurred because the facility I looked at and others had a number of more positive aspects, including job training, which was probably the most appreciated single element, but also help in obtaining a GED, group counseling, and so on. Yet I raised the issue of abuse within the treatment programs to highlight both the lack of regulation that these programs are subject to and the way in which a punitive orientation toward treatment has defined many of the programs that work primarily with clients from the criminal justice system. It's nothing like celebrity rehab, for example. Elsewhere, I write about how these disciplinary schemes function in relation to normalizing the poor in relation to a low-wage labor market. But today, I simply wish to impress upon you the punitive nature and borderline constitutionality of much that passes for treatment within these facilities. While it was a great achievement to overturn the Rockefeller drug laws, we must be absolutely vigilant, I believe, about the institutions that replace that system, perhaps particularly when those institutions act in support of benevolent-sounding aims, such as treatment. Thank you very much.
Good morning, everybody. I am really impressed that we're all here this early. I know everybody is. I want to talk about a problem that my colleagues and I have been working on for a long time, which is policies that have repeatedly displaced poor populations, particularly African American populations. And I want to look at the question of how does mass incarceration become part of that? We've always proposed that it was part of the series of policies that are of great concern because they have disrupted poor communities. But what I want to do is talk a little bit about how this happens and what the implications are. So this is the model that I had originally proposed in 1993, just very sketchy, based on kind of at the beginning of understanding in Harlem and other African American communities that policies of urban renewal, deindustrialization, planned shrinkage, and this is actually, we actually started this before gentrification was obvious, but that the policies that we were seeing had, over a period of time, disrupted African American neighborhoods over and over again. We think it's important to start with redlining, which was instituted by the Homeowners Loan Corporation in 1937, not because that's the beginning of segregation, but because it's a moment when there's an articulation of neighborhoods in which there are undesirable racial elements, which includes blacks and Jews and Italians and foreign-born, and Hispanics and Asians, and where this becomes officially linked to how resources are going to be distributed. So the red areas in this map of Pittsburgh are areas where there are undesirable racial elements living, and then the green areas are where which are areas of new housing and basically well-to-do white people. Basically, this is a model of how resources are going to be distributed, and it's cutting off resources to the poor African American neighborhoods. So a decade later, those same neighborhoods are declared to be blighted. And so there are three major red areas in this map, one on the north side, the Hill District, and East Liberty, which are all demolished in urban renewal, and that's what it looked like in the Hill District. So this is the African American neighborhood that August Wilson writes about, so it's an African American neighborhood of great importance to Black culture, also to American culture. And this is sort of the late 1950s. So redlining in 1937 is cutting off sustenance, financial investment to this neighborhood, which is declared blighted and then bulldozed. And this spaceship thing, it's called the Civic Arena, is installed. What's important then is that this begins really the series of important displacements. It's a huge displacement of the African American population. Second policy of huge importance in this is planned shrinkage, which is instituted in New York City in the 1970s. It's not called, at that time, it's not called planned shrinkage in other places. But policies of disinvestment are implemented across the country. And what follows is that everything is taken out. So there are all kinds of stores or all kinds of services in these poor neighborhoods which are systematically eliminated. So the banks come out, the grocery stores come out, and the public services come out. So fire stations are closed, police stations are closed. And literally in New York City, as the fire stations are closed, the neighborhoods burn down. This is often attributed to landlord arson, but that's a minor part of what happens. The central part is the official closing of fire stations, which makes it impossible to put out the fires. So this is the Bronx, and if you look at the black area, it's where this massive percentage of housing is lost. Between 55 and 81% of the housing is lost in this section of the South Bronx. There are many complications of this because when you disperse a population, you break this fundamental social system. And in our model, what we thought about is that when you break that social system, you impair the ability of the group to carry out collective functions. So groups are supposed to socialize the young, they're supposed to police behavior, they're supposed to solve problems, they're supposed to take care of the vulnerable, and so doing this becomes more and more difficult, which is why in our model it's going down. Just to go back to the model for a second, this is a downward spiral, so the social system under this kind of pressure is attempting to reorganize. It's a self-integrating system, but hit with another problem is unable to, and so the spiral goes down another turn. Now, we thought about this as confusion, that in the first turn of the screw, there's some degree of social disorder, but people are confused, but it's not totally dysfunctional. But as it continues down, you move closer and closer to people having no connections to each other, and the degree of disorder increases. And what you see, for example, in the South Bronx, after planned shrinkage, is incredible outburst of violence. You see increases in infant mortality, maternal mortality. What's unexpected, I think all of this is unexpected, but what's also unknown at that time is that HIV has already arrived in the Bronx. And so when this poor neighborhood where there's a lot of intravenous drug use is destroyed, people are dispersed all over the Bronx, and it explodes the AIDS epidemic from something, whatever it would have been, becomes the massive worldwide AIDS epidemic that we have now. Planned shrinkage in New York is one of the major engines of the AIDS epidemic worldwide. The third thing, so urban renewal, planned shrinkage, the third thing that's tearing apart neighborhoods is deindustrialization. And this is just one map of the collapse between 1950 and 2010 of industry as a source of jobs. There are kind of three legs to the job stool: agriculture, industry, and service. And so agriculture declined by the first half of the 20th century, manufacturing declined in the second half of the 20th century. And I think it's worth considering that we are now exporting service jobs. Therefore, what are we going to do? But that's a side issue. The point is that these were how people, unskilled workers in African American and other poor neighborhoods, supported themselves. They had good jobs, they had union benefits, they had fought for a 40-hour work week, they had fought for vacations with pay, they had fought for pension plans, and all of this is taken out from under them. There's really no national plan to move these workers into the emerging industries. In many cities, the emerging industries, in Pittsburgh, for example, what has replaced the steel mills are what's called eds and meds, education and medicine. But to work in eds and meds, you have to have a lot of education. Work in education, you have to have a lot of education. And there's been no effort to get the unskilled African-American population into that new job market. What emerges instead is what we well know is both the use of drugs and the drug sales. So the whole development of an underground market for drugs, and becomes really one of the alternative ways in which people are making money. The use of drugs goes up in the context of displacement, because displacement is a very painful experience, and because the social controls on behavior are diminished, and because people are more and more feeling that they are cut off from the pathway to being part of American society. They're being moved into an alternate. And so, now part of this is a set of policy decisions that have to do with what do you do if people are selling drugs. And the policy decisions are to put people in jail. So this whole new process starts. So what is this new process doing to the community? I mean, we know it's putting people in jail, but what else is happening? And there's a very, very important broad scholarship that supports a number of observations. One, that the person in jail is part of a system of friends and family. And the system is therefore taxed with the job of staying in connection, but it's difficult to do this. This breaks up families, it undermines the survival of infants, it is very costly. It's costly to have telephone calls, it's costly to go visit, so it taxes poor families with costs that they didn't have before. And whatever the presence of the person in the home and in the neighborhood would have been, that person is taken out of the system of the neighborhood. So these are very important and I think well-documented problems. But what emerges from the new scholarship, which I think has enormous implications for my model, but also for life, which is more important, my model or life? My model, right? Robert's feeling me, right? Is the problem of the scarlet letter problem, which is that people who are convicted of a felony then can't get free of it. So it's on their record, it impedes them getting education, it impedes them getting a job. And so that there's no way that they can return to normal life. So thinking about what does that mean for more theoretically, a community has been injured by the implementation of a policy of mass criminalization, which is taking a huge number of people and putting them in prison or under the control of the criminal justice system. But it is also, as it has developed, saying that once they have this status of criminal, they can never be free of this status of criminal. So that's the scarlet letter problem, right? Once she's committed adultery, she just decides to wear the scarlet letter for life. Now what this means is that the effort of the social system to reintegrate, to pull everybody back together, is inhibited because there are people that can't be pulled into the system. They can't be pulled into housing, they can't be pulled into education, they can't be pulled into jobs, they can't be pulled into normal family life because they carry this stigma status. Now what that means is that as opposed to being able to become, to this effort at reintegration, which is the normal pathway for a social group that's been disordered, and it's what we think of as resilience, which is the social group, right? Isn't that the buzzword of today? Everybody's resilient. Social systems do make an effort to recover after a disturbance, but if there's something that impedes the capacity or the ability or the right to recover, then it's very difficult to do that, if not impossible. And so what Roger Qualis and others have hypothesized is that creating a class of people who can never exit this stigmatized status opens up a doorway for reorganization, because there will be reorganization, but reorganization not as healthy communities, but in subgroups that become hyper-violent criminal enterprises. So in Mexico, where the drug gangs and other gangs do kidnappings and make money that way, is a model of a hyper-violent criminal enterprise and suggests one possible pathway that we might be on in our society if we don't deal quite specifically with the burdens and stigma that are associated with the criminal justice system. Now, I think that this Sam hasn't flashed the 1 minute, so I can say one more thing. Thanks, Sam. I am very good, thanks. The last thing I want to say is that thinking about this also leads to some other reconsiderations about how do we model this process. And certainly in having raised this issue of policies that make it impossible for communities to reorganize. Not only do they disturb the communities, not only do they not help them, they actually make it impossible, right? It's sort of completely driving it in the direction of hyper-violent criminal enterprises, is that other policies in this series have had that set of characteristics. Not only did they disturb the community, not only did they not provide support for recovery, they actually make it impossible to recover. So if we think about deindustrialization in light of this, what I think mass criminalization shows us, then deindustrialization, not only did that disturb the community, not only was there no support, but because schools in poor minority communities are not adequately funded and there's no way to get education, they've actually made it impossible for many generations to come to enter the job market and to be successful. So I think that thinking about mass criminalization and the permanent destabilization of the nation is exceedingly, these are disturbing, it's a disturbing line of reasoning, but important in terms of policy. And when you think about the stigma policies, as opposed to some of the other policies, the stigma policies, those could actually be eliminated with the stroke of a pen. So it's disturbing, but it's also, could be gone tomorrow. Maybe not, but it could be. Thank you very much.
So I have to start out by apologizing to Professor Roberts. He's been contacting me for about 2 weeks for my paper. I said, man, if you don't catch me an hour before I get on that stage, you're not going to have a clue about what I'm talking about, because I don't either. Over a cup of coffee this morning, I figured it out. I see some familiar faces in the audience, but I see some unfamiliar faces in the audience. So I'll talk a little bit about the agency I work for, because it'll help set the context. At the Fortune Society, we've been around for 46 years, specifically serving people who've been involved in the criminal justice system. We do work on the front end and the back end, and I'll talk a bit about that. We were founded as a result of a play written by a person who had done time in prison to talk about his experience of doing time in prison and how difficult it was to transition back out into society. And this was, again, back in 1967. We have 200 people on staff now. Half of them have done time in prison very deliberately, from the frontline staff up to the executive staff. A third of our board is formerly incarcerated also by way of our bylaws. And just to give you a sense of the size of the agency, we served 4,000 people last year who have been involved in the criminal justice system. So all of our programs have developed around the needs of people in the criminal justice system: education, employment, housing, alternatives to incarceration, family services, counseling, transitional services, licensed mental health treatment provider, licensed drug and alcohol treatment provider, housing, as I said, up here in Harlem, permanent housing, transitional housing. And yet, when I look at the agency and the success of the agency, I always say the success of Fortune is really indicative of the failure of the criminal justice system, because in many ways we're providing many of the things on the back end after people get out of the system that the system should either be providing while people are inside, or that we should be looking at the point of arrest, if not before, looking at the arrest as an opportunity for intervention. But we're also an advocacy organization. I went to Fortune 6 years ago to launch the David Rothenberg Center for Public Policy to address many of the lifetime consequences, we like to call them, that face people who've been involved in the criminal justice system: barriers to education, barriers to housing, barriers to employment. I mean, one example being that even our SUNY institutions here in New York State bar people from admissions based solely on a criminal record. So you have 60 plus institutions and about 30 different policies for applicants who have criminal records, anywhere from if you have a felony, you can't apply to go to school here, to if you have a felony, we might let you go to school here, but you have to leave campus the minute class is over. So those are some of the issues that we're working on. But obviously, Fortune's programs are not the answer to this mess we've gotten ourselves into, any more than the sort of reentry mania that we've seen sweeping this country is the answer to the problem. It is sort of the equivalent of saying we're going to try to attack cancer and we're going to build emergency rooms to do so. What happens at Fortune is triage, if you will. We are dealing with people who are misserved at so many steps in the process and are the products of all of our other failed policies, educational policies, community development, healthcare, and so on. And because of the political nature of this issue, we've been sort of cornered into a laser-like focusing on reducing recidivism, although I would argue that recidivism is largely a function of the state. Whether it be policing practices or parole practices or probation practices and so on. And so at Fortune, we try to, what we do is, even though it's complicated to fund an agency of this size with a $19.5 million budget and 80-something% of that being government dollars, we put huge value in starting out with mission and allow the mission to drive our decision-making around program and advocacy and then try to find the dollars to support that mission. Because looking at recidivism alone is a very sort of low bar to set if you're trying to help extricate people from the criminal justice system. And taking this public health approach really does raise the bar. I think it adds science to the mix. It's obviously evidence-based and hopefully moving us away from emotion and fear and politically driven policy making. So over the past 40 years here in New York State, for instance, we've gone from 12,000 people in prison to a height of 72,000 in 1992. And then, you know, while the numbers are coming down, I remember reading a New York Times article recently that talked about us potentially hitting a tipping point. And I live 3 blocks from here on 138th and Lenox, and I bet you if you talk to those young men of color on the corner there, they would have seen no difference between now and 10 years ago in terms of it being a tipping point. I would argue that we're still pretty far from a tipping point. At the height of Rockefeller drug law practices, speak long enough, right? Get it to work. At the height of Rockefeller drug law practices, 94% of the people in jail and prison on drug charges were people of color, blacks. And in 1973, when Rockefeller drug law came into existence, New York State really led the country into a war, if you will. And many things came out of that, including many other states creating heavy-handed drug laws, and the 1984 Sentencing Reform Act, which took discretion away from judges. So it's great that we're having this conversation actually in this venue, the Schomburg here in Harlem, because this is a place that focuses on documenting black life in America, and the war on drugs is really one of the dark threads that's woven into the fabric of the black experience in America. And Harlem being the epicenter of the crack epidemic, the epicenter of drug use, the epicenter of drug sales, and the place where the battle of the war on drugs has been fought and continues to be fought. And it's the most expensive war that we've fought to date, right? 40 years plus, hundreds of billions of dollars spent, and millions of lives destroyed. And I was in a room recently at Princeton with some of my colleagues, and one of my colleagues, I won't mention the agency, but he talked about the war on drugs finally sort of being over because of some of the pronouncements of the Attorney General and so on. And he talked about how the conservative right is leading the way on reform, and some of the stuff he said made me bristle, not because it's because it's 100% false. There are more conservative voices at the table today having a discussion about reform than, say, 10, 15, 20 years ago, and there's reasons for that. But I worry about where we're going to land if it's the conservative right leading the way on reform, and I'll talk a little bit more about that in a second. But even though crime is down, our criminal justice system continues to operate at full throttle. And so NYPD, for instance, continues to police our communities as if they're jails. I see it up and down here on Lenox Avenue. And stop and frisk and the illegal marijuana arrests that flow from that practice have served as a feeder, continue to serve as a feeder for the criminal justice system. Courthouses continue to prosecute people like a very well-oiled machine, with many people taking pleas to drug charges at arraignment. Rikers Island, although we're down from the height of 20-something thousand people, we still have 13,500 people there on any given day, and we're spending $168,000 per person per year on Rikers Island. $168,000. That report came out just a couple of weeks ago. If you give me a young man of color and $168,000, I'll give you 0% recidivism rate and buy him a Mercedes. So something did begin to happen in the early 2000s, however. And it's interesting because I've had the luxury of being an advocate in the middle of this work at a time when things really are turning around. I exited prison myself 13 years ago after doing 6 years and began this work. And I think sort of luckily at a time when things started to change for very specific reasons, which I'll touch on, but we have a long way to go. So large numbers of people started returning from prison, which is a direct outgrowth of our policies of putting so many people in prison. 95, 96% of people that go in come home at some point. And so back around 2004, there were around 580,000 people coming home from our prisons and jails. Today, we have upwards of 730,000 coming home this year. Right here in New York City, you have 80,000 discharges on Rikers Island each year and about 22,000 people discharged from state prison. We also have an aging population, right? So we've put people in prison for so long that we have a group of people in prison that are essentially aging and costing the system way more than any of us can afford. Our system now is at $70 billion, the cost of corrections nationally. So in 2004, President Bush, during the State of the Union address, said to America that America is the land of second chances, and when the gates of the prison open, we need to help people to land back in the community safely, and then created the President's Prisoner Reentry Initiative through the Office of Faith-Based and Community Initiatives, and then urged Congress to do something about it, and there was the bipartisan passage of the Second Chance Act, funded anywhere between $40 and $100 million per year since then, which equates to about $170 per person exiting prison. So we're willing to keep people in at around $40,000 per year per person, but spend about $170 each to help them land safely in the community. But I do think there was a message sent to America when the president made that pronouncement and when Congress acted about doing things differently, the need to do things differently. And so if you fast forward, the Obama administration has held on to the idea that we need to think about reentry, and the Attorney General created the Interagency Reentry Council, which, 5 minutes, more than enough time, which is addressing things like, you know, the fact that post-incarceration collateral consequences keeps people out of college and the workforce and their homes and so on, and that the criminal justice system, even though they may not couch it this way, but criminal justice barriers to those things really is a surrogate for race-based discrimination. So any policy based on having a criminal record translates into race-based policy, whether deliberate or unintentional. In 2010, the president signed a bill reducing disproportionate tough sentences for crack cocaine. I know Mark Mauer is here from the Sentencing Project, and they were hugely integrated in moving that forward. And yet we went from 100 to 1 to 18 to 1, and I'll let Mark say what that means. I think that when you find disparities in the criminal justice system, you should work to eliminate it and not reduce it. Although, again, it is a step in the right direction. Our drug czar is pushing now for people who are arrested for drugs to go into treatment versus incarceration. Attorney General Eric Holder more recently talked about the need to move away from mandatory minimums for people caught with low amounts of drugs. The United States Equal Employment Opportunity Commission reissued its guidance to employers on how to handle job applicants with arrests and criminal records. We have justice reinvestment initiatives happening in states across the country. But more close to home, Rockefeller drug law reform, and I know one of my fellow panelists touched on this, but let me just briefly sort of reiterate, as someone who's involved in moving forward the reforms, it created retroactive sentencing relief and eliminated mandatory minimums for most drug offenses and expanded drug courts, because in this country, if you have a problem, we have a court. But it did move us towards a public health approach to public safety, and I think that's one of the more valuable things that came out of the campaign to end the Rockefeller drug laws, is the new language that even many of our policymakers, I remember Shelley Silver standing up at the New York Academy of Medicine talking about the need for Rockefeller reform and using public health language to explain why he thought that made sense. 3 minutes, don't do that again. I can do this in 3 minutes. I can do this. But there were some lessons learned. There were some lessons learned from the campaign. So the Correctional Association, which worked on this for many years, and Drug Policy Alliance, and all the other people that came together, I think we all learned some lessons, some of which were mentioned by my colleague here on the panel. One is that we shouldn't achieve drug law reform at the expense of enhancements for other crimes, right? So we shouldn't be horse trading around criminal justice reform, particularly drug law reform. And that shifting policy doesn't mean you shift behaviors. And so prosecutors really did take control of the implementation of Rockefeller drug law along with the Office of Court Administration. And I always say if you're a hammer, everything looks like a nail. And so if you're a prosecutor and you are used to locking people up as a response to crime, then even when you put people in treatment, you want to feel that they're locked up and that they're being punished. And so what do we need to do? We need to continue to move in the right direction, but we can't take our foot off the gas, if you will. So we need to be relentless in our efforts to get the general public to understand the need to take a public health approach to crime. And because as the public goes, our policymakers will follow. To be honest. So, and I think we need to expand that to not just drug use, because the young guy on 138th and Lenox that gets arrested for drugs today is the same guy that puts a gun in his waist tomorrow. And if he's arrested with a gun and he's siloed into a different track in the criminal justice system, then we treat him differently just because we have so many people in the criminal justice system that we feel the need to have sort of an automated way of dealing with people instead of an individualized approach. We need to vigilantly adopt policies that can successfully reduce the death, disease, crime, and suffering associated with drug dependency and abuse. Our leaders need to be held accountable. Our leaders, I would argue, are too timid on this issue. They're reticent to be painted with the brush of shame that accompanies the criminal justice system, involvement in the criminal justice system. And so even our leaders who come from a civil rights perspective to address this issue, I feel as though they're not going far enough in speaking truth to power. We need to reform policing. I think our New York City mayoral campaign was a referendum on policing. Parole and probation, I think we need to push parole and probation to try new strategies and have more of an appetite for risk. If someone stays out late, past 9 o'clock, I don't want to spend $40,000. I think we just need to find new approaches to community corrections. Victims and offenders, I think we need to think about language. I would argue that victims and offenders often live in the same community, in the same family, in the same building, and often in the same person. And if we spend more time thinking about that and the trauma associated with being a victim and how that translates into offender behavior, then we'd have much better outcomes. Overall, I think we need to shift language in the way we talk about people involved in the criminal justice system. I think we need to shrink the system altogether. Keep in mind that probation and correction are not the answer to reducing prisons, because both of those things grew simultaneously. And if you want to do less harm, a lot of the evidence and research now says that there's many people that we should just totally keep our hands off of, even if they get arrested for a charge, because you can actually do more harm. And then finally, we need to recognize that the people who are closest to the problem are closest to the solution. We spend a lot of time at Fortune hiring people who are directly affected by the criminal justice system, people who have done time, people like myself, because we put huge value in the cultural competency that they bring to the table. And I think if we look at the 50 years since Martin Luther King's I Have a Dream speech, many other folks who were previously disenfranchised have a space behind the podium, and we need to build the capacity of people who've been in prison to be able to be part of this movement. Thank you.
Thanks for accommodating me, Glenn. I have no idea how I got invited to be on this panel. It was definitely not because of my technical skills. Buenos dias, good morning. So what I'm going to do is talk a little bit about framing, I guess, the last part of this panel discussion around a harm reduction approach to these issues. And this is really, I'm going to take it from the perspective of how we work with drug users and really a public health approach to drug use and drug policy. Before I start, I want to thank Dr. Roberts for giving me 2.5 hours to do my PowerPoint presentation. Thank you. I got on this panel actually because one of my board members, Dr. Diana Hernandez, recommended me, so I want to thank you. Also want to recognize a couple people, Dr. Ernie Drucker, who's a friend and a mentor of Boom Health and Citywide Harm Reduction previously, and Dr. Curtis. I don't know if he's here. I know he's got to teach today at noon at John Jay. So really what I wanted to do, this was the framing question for my particular presentation, and it's really, what is our vision of health? And, the current vision of health in our country from our president really has been about the Affordable Care Act and the whole challenges and the battles that continue until right now at this moment in our history about how it's really a fundamental question of how do we shape our future? And if we turn the clock back, 30 years plus, 40 years plus, when, Medicaid and Medicare passed, there was controversy then. Now, try to take Medicare away from a senior right now. Imagine across the street at Harlem Hospital without Medicaid funding and our ability to serve our communities. And so, sometimes we need a little bit of a historical perspective on this, but really love this quote, and it actually drives our vision for our work at Boom Health, which is, we really didn't come here to fear the future. So much is based on fear around punishment, and a lot of the issues that my co-panelists discussed really came here to shape it. So the next fundamental question is punishment. Is this the approach to public health? Because essentially what we're experiencing and what the panelists throughout the 2 days at this conference have really talked about is essentially a synergy of plagues. We talk about framing this around the war on drugs, mass incarceration, poverty, health disparities, etc. These are all of the issues that we're trying to address with no clear, coherent framework to address them. Or do we frame it as an issue of health, wellness, and safety? And when you look, I'm really upset that I missed Ethan's presentation yesterday from Drug Policy Alliance, because we use the Drug Policy Alliance's 4 pillars to really frame our work. And while today I'm going to be focusing on harm reduction and speaking a little bit about that, it's really about all of the things that we're talking about here. It's treatment, harm reduction, prevention, and law enforcement and safety issues. This, by the way, where do you think this picture is from? I took this picture. Bronx. Yeah, it's the Bronx. Where? That's great. Yeah. It's actually City Island. It's a Long Island Sound, right in the Bronx. So harm reduction. I'm not going to spend a whole lot of time on this, but I did want to highlight the principles that were developed by the Harm Reduction Coalition right here in New York, and take a look more specifically at the ones highlighted in blue. And I was really pleased as I was listening to my co-panelists on them touching upon each of these issues, particularly, the quality of individual and community life and well-being. Nowhere up here should it say or does it say we're going to meet people where they're at, because I think that's already lost all of its meaning in a lot of ways. It's really about quality of an individual's life and how you treat someone and how we treat each other. Next one is, the design of services really non-judgmental and non-coercive. People choose to engage in these services, and we'll talk a little bit more about that. And recognizing the realities of poverty, class racism, social isolation, past trauma, as Glenn mentioned, sex-based discrimination, social inequality, etc. The last one really affirms that drug users themselves are the primary agents of reducing the harms of their drug use. Really seeks to empower users to share information and support each other. And if you ask me, what do we do at Boom Health, we really work to tear down a lot of these barriers so that individuals can support each other and help to regenerate a sense of community that's been torn down for the last 50 or 60 years. And so that sounds lovely until this happens to you, right? The great philosopher Mike Tyson said, everybody's got a plan until they get punched in the mouth. And I'm not even going to try my Mike Tyson voice right here. I need a couple shots of tequila to do that. But, this was me when I came up to do my PowerPoint, right? You get punched in the mouth every day. We always do. But how do we respond? How do we respond? And that really gets to the core of the resiliency in our communities of color, people who are using drugs, people who are involved in sex work, people who are experiencing violence. It is simply miraculous that we have the resiliency to take these Mike Tyson-like punches and to dust ourselves off. This guy didn't, and get back up, to fight another day or another round. And so for us, in our model that we developed, that Dr. Roberts, spoke a little bit about already, BOOM actually stands for Beyond Our Original Missions. And really, our mission is to transform lives through health and wellness. Our staff and our program participants came up with this and then presented it to our board. It was really participatory. And I think that, while today I'm not going to talk about our merger necessarily and everything else, I wanted to also just highlight the fact that with changing needs of our communities, we must change. We must change. I'm not going to wait for full implementation of the Affordable Care Act or to find out what happens with Ryan White reauthorization or what happens with Governor Cuomo's Medicaid redesign in order to more effectively serve our communities. I think we don't talk about values enough and shared values because they're implicit in everything that we do, and they're made explicit every time we discuss these issues. It really underpins all of our work. These values were, for us, for Boom Health, were arrived at literally by our program participants and our staff, and these are ranked ordered. When we went through this exercise earlier this summer, we had over 200 values that were listed out. Look at the number one value that rose to the top, being non-judgmental. Imagine if we could all function like that as a society, how much better our lives would be. And our vision is really at a top level to improve, to have health, wellness, and safety for all. And I think it's critical that as a community-based health organization that we include safety because of the impact of stop and frisk, because of the impact of incarceration, because of the impact of just keeping each other safe in our communities really contributes to health and wellness. Our particular model, similar to Fortune Society, really has advocacy at its core. And, we've got this range of services. The pieces that are more aspirational right now are social enterprise and job training. We're going to be announcing a Boom Cafe social enterprise to work with youth on training them to become baristas, and our adult program participants to work in commercial kitchens in order to get those job training skills that they simply don't have. And if anybody ever tells me that an active drug user doesn't want to work, you got to come visit my drop-in center. It's the number one request that I get every single day is, necesito un trabajo, I need to work. And so instead of farming that out, we're going to be working and building our community around these pieces. All this takes leadership, and it was interesting. I really love this quote. I think it's a repurposed quote from former Secretary Clinton, but she said, leadership is not a birthright. It has to be earned by each new generation. She said this in her farewell speech. She's currently not employed by the federal government, but who knows, in a few years down the line, she might be re-employed. And I think that what strikes me about this is that the youth of today have so much opportunity, almost unprecedented in human history, with their access to information. I mean, my 11-year-old is FaceTiming with his friends in other parts of the Bronx, his cousins in Puerto Rico and Chicago. And I was thinking how we had a Campbell soup can with a string from the 2 tenement buildings between my apartment, and my friends. And it's quite amazing. And I think that there are real opportunities here to work with and to develop the leadership in our communities. And for us, we work to ensure that all of our program participants have opportunities to engage in leadership, to engage in helping to change policies. This was on the Robin Hood tax, and this was recent, about a week or so ago, marching, in Wall Street. And these are program participants and peers and staff who can explain to you the intricacies of the Robin Hood tax and how that 1% tax would help to fund, us ending the global and domestic AIDS epidemics. And so we really believe that harm reduction works as an approach, as a public health approach to drug policy. Consistent with the Drug Policy Alliance, we believe that New York can be the model for the country using a public health approach to drug policy. I just plucked out a few examples, but if we were to distribute naloxone, throughout the country, we would literally avert up to, 43,000 deaths. We averted 24 overdose deaths this past year in our drop-in center at Boom Health. And, the loss of life through incarceration, through unnecessary deaths in our communities, in communities of color, is such a drain on talent and skill and life that we need to, there's some easy fixes. This would just take a public health approach by the CDC to ensure that naloxone is available. We did a Boom Health survey with our program participants that was led by Dr. Hernandez through Columbia University's Mailman School of Public Health, and I could do a whole session just on that, but the bottom line is that harm reduction works. Our program participants, at the 3-month mark when they come to us, the 6-month, 12-month, and 24-month mark, show dramatic and sustained increases in safer behaviors with injection drug use, with their sexual behavior, with violence, because they're in a stable, supportive environment. Not so much because I have the best social workers and outreach workers in the city. They're wonderful and they're talented, but because we created an environment where folks can help each other through this process of their drug use and other issues that are impacting them being able to become well and healthy. And then, the classic one is, syringe exchange is literally the most cost-effective and successful HIV prevention tool ever known to mankind. And yet, it's so politicized and moralized that we forget that it's a public health approach. And that's really the framework for our work at Boom Health. So I wanted to end on this quote, which is has become one of my favorite quotes from a Bronx girl, Supreme Court Justice Sonia Sotomayor, who really said that, and this speaks to a lot of the themes that we discussed today, is the dynamism of any diverse community depends not only on the diversity itself, but on promoting a sense of belonging among those who formerly would have been considered and felt themselves outsiders. The process of incarceration, the process of mandated anything, is in many ways to isolate and to break apart into little bits our communities. And so a lot of the process by which we heal our community is bringing everybody in, and not in a paternalistic way, but in leading the way. And so I encourage everyone to keep an eye out on our Boom Health website, which is launching on October 18th. We're also going to have an iPad app, and it's really going to be an opportunity to engage at all levels in our work, in our advocacy work, give opportunities to volunteer, and really to participate in the conversation in a place in the city where I truly believe, and I've been around the block, I truly believe that if we in the South Bronx, the poorest congressional district, Mott Haven, where we're at, is the poorest neighborhood in New York City, 46%, are living in poverty, some of the highest crime rates. Our commanding officer at the 4-0 was the one that was caught on tape, in the big stop and frisk, trial. If we can make some of these changes in our little piece of New York City and the world, that it can be done anywhere, but we have to start from a perspective of health, wellness, and safety for all. Thank you so much. I was honored to participate today. Thank you.
Let's give another hand to our panel, please. Thank you so much. We do have some time for questions and answers, so I think we have one microphone, so if you'd like to go ahead and queue up, and I have a few comments I'd like to make as well. First, I apologize for my aggressive timekeeping. What could I say? It's my job, right? These were fascinating papers. I was really pleased with the way that they all spoke to each other. And we have a lot to talk about, and I'm sorry that our technology faltered for a few minutes there, but hopefully we still have some time to talk. There were a lot of themes, I think, that we saw here. In particular, I have notes on several of them, but I really want to point out maybe just a couple. One is that so much of the war on drugs, so to speak, which we've been here this weekend to address, is also about regulation, right? It's like regulation of people. And so it helps us to, and this came out in some of the panels yesterday, in fact, as well, that we should remind ourselves that we need to pull back at times and think about some of the larger, kind of more, distant connections that this problem has with other systems of inequality. Regulation, of course, for Kerwin Kaye's paper, is that there's a danger here in these kind of neoliberal reforms, right? Like, in drug courts, for example, where we think it's an alternative to incarceration, but in fact we might be putting people into other forms of regulation. Regulation comes from markets, and that's been the case at least since redlining, as Dr. Fullilove told us as well. In particular, I want us to think about, and I'm sure some of our questioners here might have questions about this as well, but I also want to point out that we should also think about something that these papers bring up, which is what exactly are we working for? And so much of kind of anti-drug war, when we talk about fighting the war on drugs, challenging punishment, that we also have to think about, well, what are we working for as well? I think it's a really interesting point, and this came up yesterday and at this panel as well, that we have a lot of conservatives who are also arguing against the drug war as well. And I'm happy that they're there, but we kind of might want to wonder that clearly what our reasons might be different than those that they may have, and that once this thing, we have reasons to still fight the drug war. I don't think it's going to end tomorrow, but it will end eventually. But we should be thinking ahead about what are we working for, because probably what we're working for is not what our ersatz allies on the conservative side would be working for. I had other thoughts on that, but I see we have a queue going on, so I hope I've kind of thrown a few seeds out there, and I think we can just go ahead in line. Do us a favor, please give your name and where you're from, and speak into the microphone, please.
Hello, my name is Richard Del Rio. I'm coming from Chicago. Thank you for the panel. Very nice to see you all today. My question is for Mr. Robert Cordero. During your presentation, you gave a list of various methods and principles that are guiding Boom Health and that you find there to be some success. One that struck me that I'd like for you to extrapolate on is the model of co-leadership.
Thank you, Richard, and I'm actually from Chicago, Humboldt Park. So that's pretty cool. That's the first question. Our co-leadership model actually, in our merger, of equals between Bronx Aid Services and Citywide Harm Reduction. You know, one of the big barriers to any partnership or merger is for people to be able to put their egos aside for what's best for a community. And we knew that operating as a syringe exchange, and as a separate aid service organization that had complementary services and trying to improve those services for our community wasn't going to work if we kept separate, but if we went through the hard work of uniting, that it would be far more effective and impactful. So what do you do when you have two leaders of two different organizations with deep and colorful histories, and you decide that you want to merge? Well, in our case, we worked out with our board of directors to have a co-leadership model. So Jose Davila is the Chief Administrative Officer of Boom Health. I'm the Chief Program Officer. If you know me at all, that's really where my love is in advocacy and developing programs and services and bringing resources to our community. And we've been able to, it's only been about a month and a half so far, but we've been able to really work that out. A lot of this in our communities is also about succession planning. You know, I have no ownership over where I work. I'm serving. I'm a servant to others. I make that clear every single day. When my time is gone, I go. And I do not suffer from founder syndrome. And I think, you know, in our communities, you have to make way for new leadership. And so in our case, you know, Jose Davila is moving towards retirement and in a couple years, and we've done an intentional succession plan. And I already have an intentional succession plan with our leadership when I leave. And, you know, because that's one of the very destructive things that happens in our communities is we take ownership over things that are for the public good, and we don't know when to let go. We don't know that moment when to allow the space for others to step up and to address these challenges. So I won't say that it's easy having a co-leadership model, but doing it makes sense. And the other component that wasn't up there to our co-leadership model is our consumers, our clients, our participants drive our model. We have program participants on our board of directors as equal voting members with the board. So I think that's a model, not necessarily the model, but I think that, you know, it's important to look at new and different ways, you know, to change and to further our impact. And thanks for the question, Richard.
Yes, good morning. Thank you so much. Onaji Maweed from Reality House. We are a social justice, cultural competent agency that shares much of what was said by the panelists. Dr. Fullilove, if you could explain to us again maybe that cycle, and also how do we go from the bottom up? If we find ourselves at the bottom of that cycle, what are the steps to reverse it such that we can now bring forward social reintegration with ourselves and our community? Because that's, I think, would be the antithesis of that model in terms of coming out of it and creating community again. If you could explain that, that would be wonderful. Thank you.
That's like, that's easy, right?
Yeah.
Softball. That's a softball. Did you see it going over the fence? No? Happily, I wrote a whole other book to explain what I think people are doing to come back. It's difficult when there are laws like this in the way, but the intention of communities is to reintegrate. And actually, much of what Robert was articulating about people who are on the margins having a sense of belonging and coming together and expressing your values is what is at the beginning. And what Sam said, that you have to find what you're for, that you can't recreate communities unless people know what they're for, that's, I think, quite at the beginning of the struggle. So in my new book, Urban Alchemy, I've been traveling around to cities in the United States and France and asking urbanists, what are they doing, and looking at what they're doing. And I came up with what I call elements of urban restoration, of which there are 9. And so you can read all about it, and I think that people are applying these, and it's hard work, it's slow work, And so the one I want to bring to your attention is that the ninth element of urban restoration is to celebrate, which basically means have a lot of parties, because otherwise it's really discouraging work. Thank you.
Good morning. I got here a little late, but I did hear some of what some of the panelists said. I wish I'd have been here to hear all of it. Two things that I'd like to bring to attention. I heard about Rockefeller drug law, and I also heard about the aging persons in prisons, two of the campaigns which I was involved in and currently involved in. One of the things that I noticed that doing campaigns and coalitions, a lot of times the work that is done through the different advocates and advocacy organizations, putting these initiatives together in addition to looking towards the end results will basically relate to the people that will be coming home, which relates to reentry. And one of the things that I have found that when doing these different campaigns and things of that nature there, that a lot of times when these things are put into effect, the other end of that is what services will be needed, what services will best benefit those coming home, where's the money coming from? A lot of times things are put together, and what happens is that these campaigns that have been implemented, that when it's come to full effect, the actual effect and the works that was done for is not fully realized because the services, the money, and all the things that are necessary to go in this particular component is not in place at the time. So a lot of times that it's not really effective as it should be. Now, one of the campaigns that I'm currently involved in is a RAP campaign, which is a correctional, social, and release aging persons from prisons. And one of the things that we were talking about while we were doing our planning is that what do those people coming out will be expect? Where they're going to go, what services they're going to have, and where's the money actually going to come from. So I think that one of the things that we need to think about as advocates, as reformers, as people that are part of these different campaigns is that when we put these campaigns together, what services are going to be needed, where the monies are coming from, and where are the people actually going to go that's going to be accessing these services. So I'm just putting this out there, and anybody can answer this here. So I just want to make sure that we also include all of these things that are actually the main ingredients of these campaigns and coalitions and reforms when they are actually put in place. Where the money coming from, what services are going to be needed, and how they are actually going to benefit those coming home.
All right, I think I also want to add to to Victor's question as well, that you know, this kind of highlights some of the issues that we're confronting here. I mean, if conservatives are against the war on drugs, we could be probably pretty sure that they're not for expanded services for people coming home. So I think that is something that maybe all of you could take a few minutes or a few seconds to answer or address.
Money's going to come from taxpayers, for number one, right? And maybe a few progressive foundations. But for the, you know, for the services, I think, you know, Glenn from Fortune Society really framed it well. Just the cost, you know, differentials, you know, between the investments that are being made in you know, treatment versus, you know, people being released. I think that's, I mean, I think that speaks to the question.
Victor, thanks for that question. So when I talked about Rockefeller drug law reform, the campaign, I think I sort of highlighted that, at least for me, it was one of the biggest successes of my career and simultaneously one of the biggest failures, because the campaign to get rid of the mandatory minimums was successful, and yet if you look at implementation, what's happening, it's getting better, but what's happening really doesn't reflect the intent of the advocates or even the legislators who helped us to move it forward at the time. And around the service piece, I remember we happened to have done it at a time, and it was actually part of the perfect storm that allowed it to happen, which is that the economy had just crashed in 2008, which helped create the atmosphere for drug law reform in addition to a bunch of other things. But it allowed a conversation about the investment of stimulus resources to respond to the reform. And I remember sitting with folks at the Division of Criminal Justice Services and talking about how they would distribute those dollars, and we were lucky enough to be one of the agencies that would benefit from those dollars. And then we were told that we could only use the over $1 million that we were getting for employment. And here's an agency that has 30 different services, very deliberately, right? Very holistic in our approach. And here we get this $1 million+ to respond to Rockefeller reform, and our hands are tied, and we're told that it must be used for employment. So that's one piece. And the point I'm trying to make is that as we move forward on these advocacy campaigns, we need to be thinking of just that, right? If we win, if we're successful, what does the world look like afterwards? And then the other piece is that you'll find in doing this work is that as you identify need, and you start building things, it means that you're also ahead of the funding curve. So at Fortune, when we built housing for people who were coming home from prison, because we increasingly recognized that people were becoming very unstable in our programs because they weren't adequately housed for all sorts of reasons, including gentrification, we started building housing, and it doesn't go the other way around. You don't go looking for the housing dollars to build housing. You build the housing, and then hopefully the dollars follow afterwards. But as you think of creative solutions that are service-oriented, you will always find that as you build it, you are way ahead of the funding curve, and the funding just needs to catch up. Otherwise, everyone else would be doing the same thing, and there would be no need.
Yeah, and just to add briefly to that, I think also in addition to services, there's also just a need to think about other issues around housing policy, as you're saying, or jobs policy. I mean, it's one thing to have a job training program, which is very important, but then the jobs have to be there, and it just really doesn't work unless those other elements, those broader policy elements are also in place. So.
Yeah. I also want to add to that as well that sometimes what's lost in the discussion, this came up a couple of times yesterday as well, and it probably will again today, is that we've often framed this question in our kind of popular discussions as about, is this a savings? Is this, given the economy, can we save money? And that is an important point, and it will get many people's attention. But also we need to keep in mind that there's also kind of resources that we are losing, in fact, by not having people home as well. This came up at last night's plenary, in fact. There are many people who are locked away who could be, very useful contributors, who are brilliant people. And we need to keep that in mind as well, that it's not just the cost savings, but also what we're actually losing out on in terms of resources as well. I think we do have time for a couple more. We're going to go a little bit over time, but we have some buffer time between now and the next panel. So please state your name and question.
Yes, my name is Daniel Fryer. I'm from the University of Pennsylvania. And first I want to say thank you everyone on the panel for your talk. I learned a lot and I really enjoyed it. But my question is in particular for Glenn and maybe even Dr. Roberts. Could you sort of reiterate something that he said in relation to the skepticism of the Conservative Party leading this sort of advancement of trying to fight the war on drugs? And I just want to ask a question about why are we just generally so skeptical of the Conservative Party leading this sort of movement? I guess intuitively you would think, just because they're not normally advocating for advantageous policies that's going to be beneficial to disadvantaged communities. So we ought to be skeptical of them having a advantageous goal in mind when they're arguing for or against the war on drugs policy. But you could point out, in the same light, you could point out historical circumstances where the Conservative Party did do plenty of things that was advantageous for disadvantaged communities. And this is particularly the case where the intent or the goal is a financial incentive, right? So I imagine one of the main arguments that the conservatives make for ending the war on drugs is that we have this sort of strong financial incentive to decrease the amount of people incarcerated in our society. And we could point out many circumstances where they sort of indirectly had beneficial effects for minority blacks in particular in the past, right? Like right before Brown v. Board in 1954. So the point is given. So I'm just generally asking about the sort of skepticism. If you could say a few things about the skepticism of conservative leading the issue.
So to clarify, I think there's huge value in having a conservative voice at the table to undo the mess that we've gotten ourselves into. And I'm not suggesting that they, number one, shouldn't be at the table, number two, that we shouldn't be partnering with them. What I was really speaking to is actually what feels to be a decreasing voice from the progressive left on this stuff. And so when the right takes the lead, there's the idea that, well, wow, if they're doing it, sort of let them do it, because we get involved, things may actually slow down because we're often painted as being soft on crime and so on. My concern is that a lot of it is driven by economics, right? And that's a double-edged sword. If your only argument for reducing the amount of people in prison is that it costs too much, then the suggestion, right, the flip side is that if we had all the resources in the world, then we're not doing anything wrong. And so I do worry about the lack of the moral argument there. And then when you do get the moral argument, which has been made by the Christian right conservative about the need for redemption and transformation, I worry about a lot of that is on the reentry side of things. And you know, I say, if you believe in hell, if you believe in heaven, you believe in hell. And they seem to be very comfortable with putting people in prison for a very long time still. And so I worry that this gravitation by the right towards the idea of doing something different around reentry will have us lose focus on the front end of why people end up in prison to begin with. So those are some of my concerns.
I'll just take, I'm not a panelist, so I don't want to take up too much time with an answer, but I do want to address. And tell me your name again, brother. Daniel, thank you. That's a great question, and my offhanded comments should be held to account, so I do appreciate that. What I was saying, much like what Glenn was saying, is that yes, we do need allies and partners in this, in the sense that we have interest in being against something. But if you look historically, particularly the recent history, meaning the last 20 to 30 years, that our people on the other side of the aisle, so to speak, and actually I don't even want to use kind of congressional terms, but just kind of the more conservative elements, have not been particularly invested in, for example, community building in cities. That a lot of the conservative movement was based in the Reagan years on kind of basically eviscerating urban policy. And so drug policy in a lot of ways is urban policy. It's really not about drugs at all in a lot of cases, right? And so what I find, when we put this panel together, the composition reflects, you know, basically people who are thinking about this answer. So for example, harm reduction, as the points that Robert put up illustrate, really involve people's empowerment. They really kind of show the shortcomings of not just criminalization, but also medicalization. The idea of meeting people where they're at, and Robert said that's a phrase that may not have traction anymore, but I might argue there's a lot of people who have not heard that phrase and certainly don't understand its import. So I would say, you know, keep rocking it. But you know, these are things which are very different, I think, from what the conservative agenda has been. So I did not articulate that very well the first time, and I appreciate that question. So yeah, but I'll leave it there. Thank you very much for that, Daniel.
I just want to add on to that. I guess a couple of the ways that the drug courts and judicial diversion have been sold has been, on the one hand, for liberals, it has appeal as a humanitarian sort of, you know, offering of treatment instead of punishment, and it sounds really good, even though there's a lot of punishment actually involved. And on the other hand, cost effectiveness. But that cost effectiveness is rooted in the fact that it's diminishing punishment for certain privileged populations while intensifying it for other populations. So my nightmare scenario with what we currently have, with what we've replaced the Rockefeller drug laws with, is basically we've taken the drug war and we're allowing the effects of the drug war to be diminished for you know, more working class, wider populations that were starting to get caught up in the drug war. And at the same time, we're actually intensifying those effects for intensifying the drug war and imprisonment for poorer populations, more disenfranchised populations, blacker populations, and that this is cost effective. And so this, you know, looks good. It looks humanitarian. It's saving money. What could be wrong? But politically, so there's, you know, the moral argument, but also the political argument around how the drug war works. I think my fear is that this is actually going to wind up intensifying the effects of the drug war on Black and Latino communities.
Can I give just one more concrete example to respond to that question? If you look at justice reinvestment, which I briefly mentioned, there was a report written recently, the idea that you take a look at your criminal justice system, your law enforcement system, and you extrapolate where you can save dollars and you reinvest it in the communities that are impacted most by crime and incarceration. And instead, that model, now that the right has sort of sunk their teeth into it as something they believe can work, has really been bastardized, and now those resources are invested in law enforcement. So now you're saving dollars on the back end and reinvesting it on the front end so that you're actually pulling more people into the system.
I just want to add that all the processes that I talked about that have torn apart the American city have contributed to the terrible crystallization of segments, and that buying into the idea that there are liberals and conservatives is really part of the naming of this fragmentation, and it's actually very dangerous. We're paralyzed because we see each other and we name each other by our membership in groups. And the fact that we have no functioning government at the moment, it is really problematic. So I think it's very useful to avoid talking about liberals and conservatives and to talk about our values and to say, what are you for? And to find alliances wherever we can, because maybe we make a little bit of progress on this and then people try to take it away, but it's okay because we'll find other people who understand that we need to reinvest in schools and we'll make alliances with them. So backing away from naming people, which I think was at the heart of what you were really saying about harm reduction, I think we need to think about this as harm reduction. We're addicted to being different, to being in groups as a society, and we need to have harm reduction about it. So don't name anybody by membership in a group. Ask them, so what are you for? What are you fighting for? What are your values? And find what you have in common. There is, in drug treatment, this incredibly important piece of advice that people get when they come into 12-step: identify, don't compare. It's the most simple, profound thing, but in terms of harm reduction for our society and where we're paralyzed by having it torn apart by all these policies, identify, don't compare is the most useful piece of political advice we could implement right now.
All right. Daniel, again, thank you for that question. We had 9 panels in this conference. Clearly, we could have had a 10th on politics and identification and all that, but I'm not going to subject you guys to an impromptu 10th panel. Dwayne, I think we have time for one last question.
Okay, we have 5 minutes. My name is Dwayne Nash, and I'll make a very quick question, very simple. Glenn, you mentioned the reforms to the Rockefeller drug laws. As a former prosecutor, I don't see the positive effect of any of these reforms. So if you can say how it really has changed our drug policy in the country and how people are being prosecuted. The other issue is, I know one of the reforms is that there's been money put into deferment programs from prisons to treatment programs. So Kaye, I think you mentioned, I know you mentioned that. Could you talk a little bit about the effectiveness of these deferment programs? Largely, the issue of the drug war is that how many people are funneled into the prisons. So how many people are actually deferred from prison according to these new plans? I think that the numbers are probably very small. So those are the 2 questions. Professor Fullilove, I would love to ask you, well, what happened with the middle-class black people that were living in these neighborhoods during the shrinkage? They didn't all leave, but
I think we might just choose one of those questions, giving our
I can
time
ask you that
constraints.
later. But the other 2, Glenn.
Unless you want an 11th and 12th
No,
panel,
no.
I mean, we could.
You're up to 3 questions.
No, I said I'll ask you that later when I see it.
See what happens when a lawyer says they're going to be brief?
That technically was less than a minute, my question.
I'll start. So I hope that the message heard was actually that Rockefeller drug law reform has not created a significant amount of changes within the court system in terms of diversion. However, if you look at the state's data on people who've been diverted since Rockefeller reform versus pre-Rockefeller reform, the numbers are significant. I just wonder where they're being diverted to, because our alternative to incarceration program, for instance, has seen no measurable expansion of people arrested for drugs in those programs, even though we've run them for 2 decades. I do think drug courts have taken advantage of this, but I worry about the same thing you spoke about, net widening, the idea that we're putting people into these programs and suddenly they're facing increased punishment as a result of being in those programs. But I do think there's something to be said for culture shift. So around the country now, a lot of states are starting to create diversion programs, mostly out of necessity because of budget issues. But I think something that they're sorely lacking and we have here in New York because of just how long we've been doing alternative to incarceration and diversion, is just a shift in culture in the court system of judges just even realizing that there may be other options as opposed to incarceration. So I think other states who are trying to turn things around quickly instead end up in this situation with the drug courts, which are overly punitive, as opposed to what we have here in New York, where you do have 10, 12 very large alternative to incarceration organizations that start with mission and approach the idea of diversion much differently than, say, the drug courts. So if I have to look at the value in drug law reform, I'm hoping that it's around the shift, the increased shift in the way judges think about what they can do when they have a defendant standing in front of them.
All right, I think with that, please join me in thanking our panel. And thank you to all of you.